Okay, and welcome everybody to PerfWeb 2. Our topic today is going to be on generational differences in work ethic, mostly amongst perfusionists, but I think it really transcends perfusion and is everybody. So hopefully we'll get some maybe non-perfusion folks that call in and talk about it. Welcome again to our studios. I know maybe you were with us here last week or a couple of weeks ago when we did our first webinar. So welcome back. A couple of things. If you look down below at the bottom of the screen, you will see our call-in number. When we open the phones, we'll get an indication and we'll say, okay, the phones are open. Go ahead and call in with questions or comments, or you want to be part of the dialogue and conversation. You're more than welcome to do that. Keep in mind that there is between a 20-second and 1 minute delay from what you see on the web to what's actually happening here. So please turn the volume on your computers down because that'll be a little confusing. But when you're talking to us, it will actually be live. You just won't see it play until 20 to 60 seconds later on your own computer monitor. So just remember to turn those volumes down. You also have, and I think Roger's going to show us, on your YouTube channel, a live chat feature. I have my computer open to the page that you're also looking at. So if you type something here, I'm going to see it and moderate it. And if a good question comes up here, then I am going to ask that question to the panel. If you would please, when you call, announce your name and where you're from and what you do for a living. And when you chat, also let me know who you are, where you're from, and what you do for a living so that we can properly address you and we know who we're talking to. So I would appreciate that so much. Also, and most important, please, if you haven't done so already, click the subscribe button. It's right there below you. You can see it on the YouTube channel. Push the subscribe button. It really helps us a lot if you will do that. So with that said, we're going to start this evening off. And again, I want to thank you on behalf of the entire panel with welcoming everybody that is here with us. So I think easiest will be to say hello to Rodell Ebus. Rodell Ebus is a perfusionist of 15 years. And Rodell, you can correct that, plus or minus, I think in that range.
Plus or minus.
Plus or minus. Plus or minus. Okay, good. And you don't want to do the plus? Okay, I mean, I'll tell how long I've been doing this. So it's really more like 18 years. You're really older than you look. That Grecian's working great. So you look really good, and you cleaned up well, too. So Rodell is a clinical perfusionist who has a lot of experience in training as a clinical coordinator at a hospital where it was a clinical rotation for, I think, 1 or 2 different schools. Ohio State was one and maybe a couple of others. You could talk about that a little later.
Sure.
To my far right is Christina Salazar. She is a recent graduate from Texas Heart Institute, and she is a clinical perfusionist at Houston Methodist Hospital right here in Houston. So Rodell is representing the Generation Xers. Christina is clearly representing the millennials. And next to her is Patrick O'Toole, also a clinical perfusionist, has also experience in industry. And he's representing the Generation Xers with Rodell. He's been a clinical perfusionist for about the same amount of time, 15 plus years. But
I'd be on the plus side of that.
You'd be on the plus side of that, okay. But you had some time off when you were in industry.
Yeah, I worked in perfusion for about 7 years and then left for 6 years and then came back and
been back for about 5 years.
For about 5 years.
Yeah, so that's fantastic. And then there's the old guy, Mike Brown.
The old guy.
Mike. One of the old guys. Well, really the old guy.
At least it's not me.
Exactly. It will be soon enough. Mike has been a perfusionist for 25 years.
36 years.
36 years. 36 years.
Yes.
Good Lord. Okay. So you started in diapers.
Yes.
Okay. And
in utero.
You have most of your career been here in Houston. Is that correct?
That's correct.
And you've done, would you say, how many cases do you think you've done?
Probably 7,500 to 8,000 cases.
That's quite a few. That is quite a few. So Mike is obviously representing the baby boomer generation, and it's going to be real interesting to hear his perspective, because I think there's this perception. Is it a perception or is it a reality that the millennials and the Generation Xers just don't want to work as hard as people from Mike's generation? And then we have Brett Mars. It's Mars or Mars with an S? Mares? Oh, I
Yes,
can't even
sir.
say his name right. Okay, Brett is also a recent graduate, 6 months ahead of Christina, and I think they're getting married too. Is that correct?
Pretty soon, I think.
Good. We might have the wedding on a webinar one day, hopefully.
Why
We
not?
can try that. But Brett's been a practicing perfusionist for about a year.
You're saying no.
A little over 2 years
A
now.
little over 2 years now.
No webinar
And he's
wedding.
clearly representing. He works over at Houston Methodist, the Woodlands Hospital. I'm not Houston Methodist, the Med Center, I'm sorry, but is going to be joining our group, HET, on the 28th of this month. So we're really happy to have him, and a lot of what he says will clearly determine his future tonight. So good luck, Brett.
About that, Christina says no to the webinar wedding.
Yeah,
No to the webinar
No
wedding?
webinar
Okay, well,
wedding.
we'll discuss that too, Brett. That's up
I'll
to
get
you.
on it.
And then I'm Joe Basha. Of course, I didn't introduce myself. You'll see me every week. And I've been a perfusionist for this. I just started my 39th year. So but I started way before Mike did. And I really consider myself a Generation Xer. But technically, I think I fall into the category of the baby boomers. So with all of that said, I'm going to turn all of this over to Rodell, and Rodell has prepared kind of an introduction for us to get lay a foundation for what's going to be the future moving on discussion.
Well, yeah. Well, thank you, Joe. Joe asked me a couple months ago when we started these webinars to talk about, something that was, passionate, for you. And I came up with something right away. And that was talking about the generations in perfusion. Because, this profession has given me so much, I feel that it's a true art. And I think we're just undervalued sometimes. And I want our profession to become, just as respected as, a physician, a PA, just to elevate the actual profession. Joe misspoke. I was not the clinical coordinator of any of those affiliates, but I was a clinical instructor for Ohio State and Rush University. And from 2005 up until I moved to Houston, I was that instructor. And it was quite interesting to watch some of these students come through and see what, their passion was or their type of work ethic. Because, they were hungry for jobs, just like I was back then. And their level of aptitude, to me, and this is my opinion, not so much aptitude, but their willingness to learn and to go that extra mile. And that started to perk something into me. And I said, I've had some great mentors throughout my career that in Detroit and in Houston that I can still call upon, and always been great with me. And they are considered the old guard. And they instilled in me this, going that extra mile, showing me that this is an art, showing me that, this is a human life that you are helping with end-stage heart disease. And that was very, very profound to me. So I wanted to give that to my students. And, the first 10 years was like that. Excuse me. So I wanted to know what was going on. So, I had this conversation with my colleagues who are, quote unquote, the old guard. And, and then we hired some of the new students that came out, and we hired them, and they had the same type of work ethic up until this 5 years ago, this quote unquote millennial generation. And I don't want to dump on the millennial generation by any means. I mean, I think they're the lifeblood. I think they bring a different dimension into our profession. You know, it's like maybe I don't have that energy and maybe they bring that. So I'm starting to see that type of perception. Are they coming in just for that check? Are they coming in just because, you know, they see that this is a profession where, like, hey, I can make some money and just pop in, pop out? And I don't think they think that way, but it's perceived that way. And it's not just perceived by, you know, the perfusionist. And it may be perceived by, like, you know, the nurses or other disciplines or even the surgeon. And to me, that is a bad thing. If the surgeon doesn't feel that you will go that extra mile or know what you're doing, it's going to make havoc on your life and the rest of your team's life. So, I mean, I think that's the gist of what I wanted to talk about. I mean, I like I said, I don't want to dump on any type of generation. By no means do I want to do that. But I have noticed that this younger generation, not that I'm old, it does lack that wanting to go that extra mile. And, you know, I've talked to chiefs across the country. I've talked to employers across the country, and they all perceive this. And it may not be true. I mean, I would love to get the perspective of the younger generation and see what they say about this type of perception. Hopefully they can dispel it, because you know what? You guys are our future. We want to show you guys that extra mile, but you guys want to go. You guys are going to want to go the extra mile. Trust me. I mean, our patients are getting a lot sicker. They've got comorbidities, and we're just going to need you guys to know how to take care of that patient so we can get out of those situations without me being there. Not to say I know everything. Gosh, no. I mean, I like I said, I've got some great mentors I can call upon and see, and they can tell me what I need to do. So, I don't know. How do you guys feel, Joe?
Well, I mean, I think that was an interesting introduction, and I think that it is a common perception, Rodell, that a lot of people have. I'm not really the right person to answer it. I'm going to kind of move this over around the panel, but I think that the question for me is going to be, is it their responsibility to adapt to what we think, just like was it your responsibility to adapt to us, which I think you have to some degree better, your generation, that is, not you personally, or is it our responsibility to learn and adapt and understand the way they think? I think it's human nature to just believe how you think is right. And it's very hard sometimes to want to accept change. Change is hard. So let's go around the table a little bit. I'm gonna move over to Mike and ask Mike to give us so you work with a whole bunch of different people. You've worked with a whole bunch of different generations throughout your career. What's your thoughts on this?
I am very much, first of all, impressed with the millennial generation, with the amount of knowledge they've been able to be exposed to. Some of the things that you guys are seeing have come obviously so much later on in the perfusion lifespan of someone like myself. And you're probably much more learned as to new techniques, new biomedical instrumentation and things than I ever was. Especially since I moved from a big academic setting downtown Houston up into, at the time, was the boonies of North Houston, up in the Spring Woodlands area. I've had a chance to bring new grads on from not only Generation X, but also from the millennials. And I have noticed that there is more of a desire for the younger people to have more of a life than Joe and I did. I think as we did ours, our school was very regimented, very military-like, and you did what the doctor said immediately. You were there to anticipate what they needed. Not to say that that has changed, but nowadays what we're seeing is we're becoming much more of a team with our physicians, which is something that I hope that you guys get a chance to develop. Our surgeons are our best friends, and we do things socially with them, but we also have a lot of mutual respect. And you guys are going to be on the forefront of that. I think the younger doctors are that way too. So of the different generations that have come up, I think that the Generation X were better equipped than I was when I first started. But there was a difference there between us in that there were more into wanting to see system processes, whereas we did the clinical, bring on the next case. These guys wanted to have the science behind what we did. We needed to have the numbers behind what we did. The new millennials, I think, have it even better than Generation X did. You guys, I wished I were just now going into perfusion. And I think that what we see from the new generation is they pick up on things more quickly than we did. Computers, simulations, these things, none of this did we have any of this. It was in the OR, that's where you learned. So I think from that standpoint, you're probably better prepared to be out there, but I'm not quite sure that you guys are used to doing the 2 and 3 cases a day that we used to do routinely from our standpoint.
And starting at 5 a.m. and not finishing
And not finishing until 11 or midnight.
If we got done, if we got out.
If we got out there that time.
I think you brought up some great points too. I'm looking forward to putting up these slides that I have of these generational differences that were looked at by psychologists that transcend our business, but still, I think our business is just one slice of society.
Right.
I mean, we're a small fraternity. I mean, I don't know how many people know this, but there's only roughly 4,200 perfusionists in the entirety of North America. So we are a very small fraternity. And I think that you're right. In the old days, we were, pump techs. We were pump monkeys. That's what we were. We weren't perfusionists, even though Charlie Reed, and I think Charlie, God rest his soul, deserves a lot of credit for trying to accomplish that. Unfortunately, he wasn't as successful as I think he'd hoped to be. But I think the surgeons have changed. You kind of touched on that. There's no more, you have to be married to have the level of intimacy of the relationship between the perfusionist and the surgeon as it is today. They depend on us for so much. And I think they have changed as well as generations changed. It's no longer those really old dudes that are just really mean. I don't want the pressure at 58. I don't want it at 56. I want it at 57.25, and that's what they wanted. They said jump, you said how high, and that's what it was like, So
yeah, I noticed a huge difference between the time I left the profession it would have been probably 2000 is when I left the profession, and then came back in 2010, around there, maybe 12. But for one, the surgeons that I was engaging with were younger, and some of them younger than me. But definitely the relationship has been more interactive, and they respect the perfusionist more. And I know we're really talking about scheduling and time, but there was definitely, you really touched on something, and so did you, on as far as the dynamic of the operating room and where the perfusionist fits in that area. But I think that I have been very impressed with the younger generations as far as their knowledge. They have more than I do as far as the real science behind what we're doing. I am definitely, I went to school, I have the degree, I keep the certification up, but I feel like I'm on the job trained, whereas I know that some of the younger people, they know a lot more, and I've learned from them as well, from what they know, and I've changed some of the things that I do behind the pump as well. But Yeah, there are definitely changes. I think they're for the best. I have not really met any younger perfusionists who don't feel this millennial thing, like they just want to eat avocado toast and not work. I haven't experienced that.
Mm-hmm. So, Christina, where do you think the perception is coming from? And I think Rodell, Rodell has, I think Patrick has a unique experience in that he was in this business and then he was in industry. So he got to travel and look at these different places. Mm-hmm. I think Mike's got his unique experience in the sense that, he's just been in this for so long. He's worked with physicians, nurses, other perfusionists of all different types of age groups. Rodell's coming from it from the, I'm sorry, I apologize for misspeaking earlier, the clinical instructor at a clinical site for these two training programs. And he clearly, I think, has an impression, which is not uncommon. It's not just his impression, but I think this is something that we've heard. Mm-hmm. Now, I think going back to your points that you just made, their intelligence and their awareness, I think, comes from, we used to have to use an index medicus. Do you know what an index medicus is?
No.
Exactly. So they've had Google their entire life. Mm-hmm. Technologically, the computer, they went from bottle feeding or breastfeeding to a computer. That's, in fact, they were probably swiping the iPad while they were feeding, more than likely. So where's the perception coming from, Christina?
I think it has to do with what you were saying about what school was like for you and what your training was like and how it was in the very beginning of your career. It was very militaristic, like you said, and it was long hours and tough surgeons and that sort of thing. And it was for us too in school. I mean, it was difficult and it was very structured. But I think it's been a little bit, or I guess intensity is a little bit downgraded, like you said, with the newer surgeons. Mm-hmm. So I think maybe it might be something to do with that, with how it used to be versus now in the relationship with surgeons and more of a teamwork environment, like you said. But that being said, I don't think that, well, speaking for myself, that we're not willing to go like the extra mile to learn and to know that we're doing a good job and being good perfusionists.
Mm-hmm. Do you think that like a really good athlete makes it look easy? And for us, right, and Rodell and for Patrick, we had to hit the books, and it was a process, and it took a lot of time. Do you think you're just more efficient with finding information out, and it doesn't have the same level of urgency because you know that it is immediately available to you and you're accustomed to that, whereas I'm not. I still have to think, I can go look this up on Google. It actually has to be a conscious thought.
Mm-hmm. I mean, sure. I mean, information is very readily available for us in that way, yeah. So.
Mm-hmm. I studied for the boards twice. So I went to school and failed the boards the first time. There was a written and an oral at the time, and I failed the written the first time around. Then I passed the written and passed the orals after that. Then I worked as a perfusionist and then left for a while, and then came back and had to restudy for what is now it was 2 tests, but neither of them were oral. And I'll tell you what, Google, it was so much easier than I thought it would be to restudy those
It really did save you.
Yes.
So, Rodell, having heard sort of from Christine and Brett and heard Mike's and my and Patrick's perceptions of all of this and some of the, perhaps understanding the mechanisms or the reasons why we might feel the way we do about younger people and their perceived lack of work ethic. What's your thoughts on it now?
No, I mean it's those are all valid points. I mean, I had thought about those things. We've had those students, look up on Google, any subject matter. But when you're in the thick of things, do you have that time to say, hey, I have to look this up? Can I say, hey, doc, give me a second. I need to look this up. You just want that. You just want them to be prepared, if you will, to have that type of situation. And like Mike said, he's done so many cases, so it's almost secondhand to him. It's that nature, and these guys have made it look so easy. And even when I was a young perfusionist, I'd look and say like, wow, how did he do that? And you try to emulate it, and it wouldn't be the same thing. You're like, wait a minute, what did he do differently? It's that type of thing, and I needed to go back into the books and understand how they did it and why they did it. And I guess Google doesn't always teach you that, is my thing. And do they have the reverence for this profession in that respect? It's where like, hey, I need to be prepared for whatever subject comes at me, and just be prepared for that case, for anything to happen. And I guess that's the way I wanted to prepare my students, not just for my OR, but for when and where they ever ended up. So has it changed? Yeah, absolutely. The millennials, oh my gosh, can they pull out the Google or any type of search engine and find me anything I wanted? But that's not the way I wanted to get it.
So
I'm in that weird realm of old guard and new, where I can embrace the technology, but I also embrace the militant end of it.
Oh, you were definitely born 30 years too late. I don't think there's any question about it. But you're welcome. That was a compliment. Okay.
I think it was.
Yeah, it was a compliment. But so how do you respond to that? Give me a response. You guys, I want to hear what you think about what Rodell just said. Do you revere your profession?
Yeah, of course.
Okay. Do you?
Yes.
Okay.
I totally agree with what he's saying. It all has to come back to how you were trained. And back in the day, you did learn so much in school, and then you were taught in the clinical field about every possible situation that came up, because every possible situation came up. Nowadays, that's just not possible, because not every school, while you're in school, does certain cases that you might have to do out of school, and not every situation might not pop up in the actual clinical field. Just like Terry Crane at Texas Heart, when I was there, had this whole packet of things that could go wrong in the OR that he wanted to review with us. And of course that helped, but if something popped up like that in the OR and I never actually dealt with it, I might not be able to handle it as well as someone who has had the experience of actually doing it.
Sure. Well, I think that's. Yeah. You can't read experience. You really can't. You just have to live the experience. I think that's true. But two things. I'll just say to the younger folks here. I think Mike knows this. Say that again. I'm sorry. Oh. Mike and Patrick have heard this a billion times. They already know it. But so either no bubbles, no troubles, or what's a little air among friends. But so let me ask you.
Out by noon without
out by noon with no balloon. Yeah, that's the key. Okay, you want a job that's like that. It's not the one you just took, though. I'm sorry to tell you that.
Sometimes.
So how many people that are either your contemporaries, Patrick and Rodell's generation, Mike's and my generation, have you guys seen that were just plain lazy? Like, how is this person how does this person lasted this long in that profession? And you don't have to be, I'm not asking for names or anything, but just give me an idea. Is that something that you could just off the top of your head say, yeah, I know a couple of people like that right off the top?
Yeah.
Of course.
Okay.
You do.
How about you guys? Have you seen
I've
you and
seen,
Rodell,
yeah.
people of Mike's and my generation, as well as people from Christina and Brett's generation and your own, who have also been like that?
I've seen people from all three of the generations. I think there's three that we're talking about. that really enjoy avoiding work, if that's what we're talking about.
Yes.
I've seen that. So
Every
I think
generation really transcends it.
Right.
it's a normal thing to try to avoid
Right.
work, right?
Right.
Well, for some people, not
Yes.
for everybody.
Exactly. Mike?
Yes. I wondered how some of the graduating students that I interviewed for positions with my companies that I've worked for all through the years, and I think I've worked for about 10 of them,
It was the same company, though. It just changed names
it just
10
changed
times.
name about 10 times.
We all,
I guess.
we're not going to mention that name
We're not
either.
going to say anything.
Not say anything.
But it was like, my word, what school did you go through? And I got pretty good at knowing, after a while, I would tell my supervisors who knew nothing about clinical perfusion which perfusionist to hire, because you could tell at which school they went to. And I got very good with that after a while. Being able to realize which one were going to be able to make it out in the, quote, real world, or which one should probably stay in academia because they needed a hand to hold them through most of their cases.
Or do loss prevention at Kmart.
Right, right. So, oh yeah, oh yeah.
So, Rodell, what about you?
Yes.
Do you know plenty of people in my generation and Mike's generation that you just really scratch your head and wonder, how has this person lasted in this profession this long?
Unfortunately, I have. I mean, it's just part of the profession.
How about
unfortunately.
Well, just in life? It may not even be the profession.
Absolutely.
Just
Absolutely.
just lazy people.
It's not so much lazy. Maybe they're just sitting back and trying to watch, like this younger generation handle what they used to handle. It's like, maybe I just want to sit back and see what these kids are made out of. And even in my generation, they may want to see, like, hey, what can Patrick handle? What can Ro handle? What can Stephanie handle? It's not so. It may not even be. Maybe another perception thing. It's like they're not so much lazy, or it's like, well, I've had my time. Like, can you handle this? Can you do this? And again, that's why I try to go that extra mile, because I don't want to get caught with my pants down.
Well, that's kind of like the law of the jungle, right? The
Yeah.
big bear's got the best fishing spot until he gets
Right.
old, and some younger bear comes and kicks his butt and kicks him out of the best fishing spot, and they usually just kind of wander off and die. I guess that's really what's going to happen to us all. When we come back, we're going to be going to a break, and we're going to be having a word from one of our sponsors. A good opportunity to maybe grab yourself a drink or whatever you want to do. You probably need a drink. We're going to start drinking over here too. But don't be long, because it's only a 3-minute break. It goes very quickly. When we come back, I've got a couple of charts for this next session that I think we can go over and try to bring some clarity to this perception thing. My gut is telling me that a lot of what is perceived is really not a reality. I really am not convinced that the new millennials, or the millennials, I guess, are naturally lazy, and that we, and even to some extent your generation and Rodell's generation, are more enthusiastic about work and harder working. I think our values and what we find important in life may be a little bit different, and I think that's social, but I'll be looking forward to showing you all these charts. So we're going to have a word from our sponsors, quick 3-minute break. Ro, are you going to be able to stay with us and come back and be part of this conversation?
Oh, absolutely.
Perfect.
Absolutely.
Thank you very much. Okay, well, and we're also going to take some phone calls when we first come back too. So if you have any if you want to get on the phone now and call in, do it now, and we'll start fielding your questions at that point in time. See you in a minute.
Imagine trying to drive a car looking only through the rearview mirror. Critical decisions would be based on old and possibly inaccurate information. The same can be true of performing cardiopulmonary bypass without continuous inline blood gas monitoring. Terumo's CDI Blood Parameter Monitoring System 500 continuously delivers 11 critical blood parameters throughout the procedure. With other systems, periodic blood gas measurements provide static information that is helpful but limited. Continuous monitoring tells you what you need to know every step of the way, and that reduces risk. Studies show a direct correlation between blood gas management and reduced complication rates. The CDI System 500 has been earning the trust of cardiac hospitals and cardiovascular surgical teams for almost 20 years. It provides continuous monitoring of 11 of the most critical blood gas parameters, utilizing industry-leading technology. During cardiopulmonary bypass surgery, the shunt sensor can be placed in any arterial or venous shunt or purge line with continuous flow. The shunt sensor uses optical fluorescence technology to measure PO2, PCO2, pH, and potassium in the blood. 4 microsensors and a thermistor well are in direct contact with the blood to accurately and rapidly measure the values. Light-emitting diodes direct light pulses toward the microsensors, which contain fluorescent dyes. The intensity of the fluorescent light from the microsensors will vary depending on the levels of PO2, PCO2, pH, and potassium in the blood. The photodetector measures and converts the light to numerical data, which is then displayed on the monitor. Blood values are always current with virtually no gaps. There is no need to make difficult judgments about when to draw a sample. Gas source or oxygenator failure can be rapidly detected. Continuous monitoring is especially beneficial during procedures on young or old patients, or with smaller perfusion circuits. Peer-reviewed clinical evidence supports the value of continuous blood gas monitoring. Contact your Terumo sales representative for a demonstration, or visit terumo-cvs.com.
Okay, welcome back, everybody. Glad to see everybody back. Rodell, good to see you again as well. Okay, so this second part is titled the old guard versus the new millennials. And I want to start off, and I think we're going to go to a full screen view of this, but I want to show you some of these charts that came out of a textbook by Berkman on generational differences. So it's a generational differences chart, and I think we have that up now. So I went ahead and, let's see, I have my clicker here somewhere. Yeah, let's see, I think this is it. Yeah, so I put an X over that because if you're between the age of 73 and 118 years old and a traditionalist and still pumping cases, please call me, okay? But I don't think the phone's going to be ringing on that. If you're a baby boomer, born and you're between 54 and 72 years old, which is Mike and I, then you're considered that. Generation X, of course, 38 to 53 years old, Patrick and Rodell. And then the millennials, 19 to 37 years old. And I really found this next slide really intriguing. So if you look at technology where the blue arrow is, let's see, is it coming up? I think that's the wrong one, Raj. That wasn't the new one. It was number 4. That's okay. I'll use the mouse. That's all right. I'll use the mouse. If you look at the, right here, technology, you can see here that for us, for the older generation, it is acquired. For the generation of Patrick and Rodell, it's assimilated. But for the generation of Brett and Christina, it is integral. If you scroll down a little bit more to workplace view on respect for authority, we are skeptical, but are becoming similar to traditionalists, time equals authority. And in terms of our view on time at work, we are workaholics, invented the 50-hour work week. We were dumb. And visibility, being there is the key. That's sort of the mentality of people that are considered the baby boomer generation. For the Generation Xers, skeptical of authority figures, will test authority repeatedly. They're project-oriented, and they want to get paid to get job done. They just get paid to get the job done, period. Whereas the millennials in this particular textbook, psychology textbook, they will test authority but often seek out, I think it says seen, but it's seek out, authority figures when looking for guidance. They're effective workers but gone at 5 p.m. Now, clearly not in medicine, but, you know, as far as an office is concerned, you really are not going to see, according to this study or textbook, the proverbial light on in the office building after, you know, at 9 o'clock with the person sitting there at the desk still working and the boss walking by and saying, "You're still working, Mark? Oh my God, you know, you need to get home to your family." But they stay, they're diligent. They view work as a gig or something that fills time between weekends. I don't know what's wrong with that. You know, to be frank with you, I think that, to me, makes a lot of sense. You know, as I've gotten older, I've come to realize that I've got just one of these lives. I can't go back and reclaim any of this time. Now, I wouldn't do anything differently as far as, you know, I'm proud of my experience in this profession. I'm proud of the things that I've accomplished in this profession. But did I need to miss every Christmas with my family? Did I need to miss every holiday vacation? Did I need to miss every birthday? At the end of the day, what was more important? At the time, I believed it was work. I think that was external social pressure of our generation and how we got brought up. I don't necessarily believe that it's right. Nevertheless, moving on, and so forth. Now, view on work-life balance. The older generation, the boomers, hesitant of taking too much time off from work for fear of losing their place on the corporate team or in the perfusion practice or group or whatever you may be. You want to be seen there all the time, the go-to person, so to speak, always available. As a result, terrible imbalance between work and family. Listen, I read this and I said, Jesus, this just describes me. I mean, it is me. Is it you?
Yes.
The same thing.
Mm-hmm.
Rodell and Patrick. Because of parents who are boomers like us and workaholics, they focus on clear balance between work and family. And I think, I know both of you. Now, you more so than you, Rodell, but I've seen this in your age category, and I think it's great when I hear, you know, I really need to take, I really want, not need, I want to take my children to this. And I'm proud of the fact that you guys sort of have that approach. I want to go to a family event. I want to do something because it's more meaningful than anything else that we do. Now, sometimes it does get interrupted. We're all in a profession where, you know, we're responsible for saving people's lives. I think it's critically important that we recognize that. But not every day or every situation should fall upon us as practicing clinical professionals in surgery and perfusion and cardiac surgery. When you go take a job someplace, that's got to be one of the questions. That has to be one of the things. And I think that as a society, we need to start recognizing that more. That, and when I do my talk on the staffing, I'm going to bring up some more of these points, more with a little more specificity to it. But we need to expect more of our employers in terms of what is an appropriate work-life balance, and not just, I'm your employee, therefore I am your slave, and I am here for you 24/7. Because as an employer, we love people like that. We want to get the most work we can out of any one person for the least amount of money. And you guys want to work, not you, all of you, but some people, I think, reasonably, fairly, and righteously want to work to some degree the least you can for the most amount of money. And somewhere in there, there's a balance. Those are the extremes, and somewhere in there, there has to be a middle ground and a balance. So I'm just pointing out extremes at this point. You guys not only balance with work and life, but balance with work, life, and community involvement and self-development. flex time, job sharing, and sabbaticals will be requested more by this millennial generation. And I think that, Ro, in my view, I think that that is that's something to me that just simply makes sense. What say you?
I'm sorry, Joe. I missed that question. That you broke up a little.
Well,
bit.
your opinion of all of those, that I can't really go back, but your opinion of all of those different characteristics, do you see that as being an accurate representation of the personalities of the generations?
I think it's a fairly good representation of the generation. It's generalized to the point where, like, hey, I see myself in that generation. I see myself within that, and a little bit of the baby boomer as well. But you know, like I said, I think I find myself in the middle of all three. Yeah, no, I totally agree with that generation.
Do you see yourself in that description?
I do.
That previous description that I gave? That's the next slide. So we can go back. Hey, Raj, can you send it back to the previous slide? I'm sorry. Yeah, thanks. No, that's the first one. Second one.
Yeah.
That's it right there. Yeah, it doesn't have the pretty diagrams around it. But, you know, basically, did that accurately describe you and how you feel about life and work?
Yeah, I definitely think that I value a work-life balance. But then again, with Perfusion, you have to be realistic with our job. You can't, sometimes you work more than you want to, but that's just part of our job as well. You can't just leave at 5 p.m. or in the middle of a case, that sort of thing. But yeah, I do value a work-life balance, and that's important to me.
How about you?
Yeah, same. You know, sometimes it's hard in this profession. You do want to go home and not work, but that's a realization that you come to learn real quick.
So I actually think that as a young person, when I was much younger in Perfusion, I was willing to work all the time because I had nothing else to do. So as I got older, Stephanie's on. Hi, Stephanie.
Hey, Steph. What happened?
What happened to Rodell?
Huh?
I have stuff to say.
Oh, good.
Oh,
You're
okay.
just in.
Well,
Okay.
you didn't call in.
It's
I
a phone.
I could say something.
Anyway, as I've gotten old, I feel like I've been several of these phases, really, in the diagram that you were showing, because as time has gone on, I think I'm understanding what you're saying in the sense that, you know, you realize that there's only a certain amount left, and what have you not experienced as you went forward. So what I've done is I've made decisions, and one of them was going back to Perfusion and not traveling full-time for a job. To make a little bit more money. I took a little bit less money to go back to Perfusion and, you know, really go to work in the daytime and come home and, you know, be home with my family in the evenings. And I think that as a person ages, those things become more important. So it may be a generational thing, but I think also everybody kind of goes through these phases. You know? And I'm pretty sure that as I get older, I'm going to want to take a sabbatical. That sounds really good. You mentioned that word.
No, you can't. You're not a millennial. Those are only
I can't
for
do that?
millennials.
Okay.
Yeah. Mike.
Well, being at the actual end of my Perfusion career and only having about another 2 years of full-time work to go, I think what I always decided, and I got it from my parents, instilled in me, work hard, and then you'll get that retirement quicker if you do that. So that's what I'll still predicate that on. I'm still working hard, still enjoying it, but I'm almost at the end of it now, so I can see the fruits of my labors. I wished that I would have had a little bit more of these guys' philosophy on life a little bit, but I'm about to have a totally wide open philosophy and enjoyment of life, so I think it's worked out okay for me.
So let me ask you a question, and this is kind of this may be an odd question, okay? Maybe, and it may be really tough for you to answer, but I want you to really think about it before we go to Stephanie, because she's chomping at the bit. I can see her over there. And 10 years ago, you have a family event that you want to go to. Beeper goes off, cell phone goes off, whatever it might be, and you've got this disaster case that one of the surgeons you've worked with for a very long time calls you up on the phone personally and says, Mike, I really need you to get to such and such a hospital because of this. Now, it's going to interrupt this family event. You're going to miss whatever this family event was for that evening.
Right.
But you go in there and you do that case. Patient does or doesn't make it. Let's just say, for the sake of the argument, they survive this episode and do well, and you know you contributed to that. At the end of the day, would you have preferred to have the family, to have not had that call and gone to the family event, or had that call and participated in the care of that patient?
That's a really good question, because that has happened a lot over 38 years, 36 years, I mean. And I would have to say that I probably got more satisfaction of going in and doing that case and helping somebody. Now, it didn't mean that I didn't have to make up for lost time when I got home, which I always did. But that is the balance that I knew how to strike when I was going through my career in perfusion. Once again, as I said earlier, our surgeons are our friends, and I've worked with one surgeon for 35 years. And if he calls me, and if he did call me through that period of 35 years, I went. And found a lot of satisfaction in that, because not only did he appreciate my efforts, but the nursing crew, everybody else in the hospital appreciated me being there, and it was very important for me to have that.
How many times did you say to your wife in these 36 years, or your children, I'm so sorry, I love you, but we will have another tomorrow. We will have another Thanksgiving Day. We will have another Christmas. This person may not. How many times did you say that? Countless?
Can't even count.
Too many to count.
Can't even count.
So how would you feel about that, Christina? How would you feel about your planned family event that you're not on call? You're just getting a call, okay? And that's what the call is. Would you feel like Mike, more gratified? Because I'm the same way. I have that same feeling. We're not saying it's right. We're not saying it's better.
No.
We're just simply saying it's how we feel. How would you feel?
I think I would be the opposite. I would get less satisfaction out of going and more out of being with my family. But I mean, you know, if we're not on call, especially, like tell the person who's on call. But I guess you have to do what you have to do also.
That's true. But and like I said, there's no. What's your view on that? Where would you get more satisfaction, out of the family event, or the taking care of that patient?
I sort of lean more towards Christina's side too, but in the same way, I mean, I would get satisfaction out of knowing that I'm helping someone.
So you would accept it, but you wouldn't have a sense of satisfaction.
I wouldn't be happy going in.
And again, like I said, there's no right or wrong to this. I mean, really, there's not. It's important, I think, for everybody to understand this, because I think that that's what the chart showed. What is important to you is just different than what's important to us. And I think your generation, I'm curious about something. Your parents, were they more like us, or were they more like you?
Well, my parents are engineers, and there were times when I was growing up that my dad would get called in for different things and have to miss stuff. So I guess more like, well, I don't know. I think it's still a balance. It's a different situation. You know, they're not.
But he missed a lot of things.
Not a lot.
Not a lot?
Not a lot. I mean, he missed
how about
things,
you?
but.
My mom was a single mother.
Gone a lot?
She worked to support us, but she was always at family events. Didn't miss much her job.
So you really don't have the experience.
No.
Maybe you do. What about you guys?
My parents were around.
Uh-huh.
They were very much around.
How about you, Steph? Well, I know your mom was around. She's right there.
That's right.
She's in here, though.
Definitely.
So
And they
so
value time off and time with family more than money. Is how I grew up.
well, that's another question. That's another good. You
And-
just brought. So but you have the floor now. You have apparently wedged Rodell out. I think he's
I
sitting.
think he's still on the
I
side
think
there a little
we
bit.
can
I
see
see
his
the
arm.
shirt,
We can see
yeah.
his shirt. Hey, Ro.
I just wanted to make one comment. That's all.
Okay.
I just wanted to say something from the perspective of being a woman in the profession and also a single mom. When I first started out, it's been almost 20 years ago, if I would have valued or outwardly valued time with my family more than work, or said, I can't be there, I have an appointment with my kid, I think that I would have looked very weak, and I think that I was always fighting to look strong in a more like a man's profession. And then I noticed when the younger generation was coming and they were saying, oh, I need a sabbatical, or I can't do that. It was a hard adjustment for me because of how much I feel like I sacrificed for the profession. So I think Ro and I came from the perspective of we wanted work-life balance, but didn't really know how to voice that. And then when it's good that the younger generation can, but it was also hard for us for them to come in and say, no, like I'm not going to do that, or that isn't working for me, or I'm going on a sabbatical.
Mm-hmm.
You know, I just.
So yeah, no, absolutely. Again, it's really tough. I mean, I have other interests.
Wait, can you put Stephanie back? Just for 1 second? To roll your eyes, go ahead. Hey, Steph. I only did that just to get under her skin. So I have the.
Exactly well, by the way.
Yeah, I have this. I'm sorry. I have the same question for you in that circumstance that we discussed, that I opened with Mike. Which would you have found if you missed your daughter's dance recital because you got personally called by a surgeon who said, Stephanie, I need you in here to do this case. You're not on call, but you're going to miss your daughter's dance recital in order to go do this procedure. Where would you have, at the end of the day, derived more satisfaction, personally and professionally?
So I love my job and I love my profession, and I get so much satisfaction out of doing a good job and helping people. But in those moments that add up over the years, I would much rather have been able to be with my daughter and not miss those things than to get the satisfaction of like, I feel great, like I saved someone, I did a great job today, but I feel like there does have to be a balance, you know, because it can become year after year of missing things, and that over the long haul isn't worth it.
Okay, I think that's it. Okay, fair enough. I think we're going to go to another quick commercial break. And so we'll take a look at a word from our sponsor. Ro, you going to still hang around, yeah? And
Yeah,
Stephanie,
as
Stephanie too? Huh? Yeah, keep Stephanie with you. Put her next to you. And well, it's a twofer. Okay, so a word from our sponsor, a quick 3-minute ad. We'll see you when we get back. Thank you very much. And start making some phone calls. Roger's going to put the number up so you can see it. And start making some phone calls to it. Be part of the discussion. I'm going to do my talk on perfusion staffing to follow this, and hopefully that'll get some thought-provoking information and commentary from that. Thank you.
Mom, your commercial's going on. Your commercial's going on. No, it's going on right now. Yeah.
Hello, this is Stephanie with HET Perfusion. Oh, okay. We have an open heart 1 month from today, 9 a.m. start. Oh, really? A single vessel off pump? No problem. Thank you. Hey, Mom, can you bring me a sandwich? Oh, thanks, Mom. You're the best.
You having a rough day, baby?
Oh, working for HET. So hard, huh?
Stephanie, go on the pump.
Okay.
Is that better?
I'm like smiling now.
Okay, welcome back. And I think right now we're going to blaze through this next presentation because we're going to be talking about perfusion staffing. And I think tying all of this stuff together with, you know, work-life balance and trying to run a perfusion department or a perfusion company or whatever it may be. So the title of it is the business side of perfusion, but I'm going to sort of modify this whole thing. So there are various different models. You've got hospital-based perfusion departments. They could be under nursing service, like at St. Luke's in the medical center, maybe some other places around the country. You could be employed by some surgeons. You can be employed by a contract group. You can be private as an individual or doing locums at various different places. And some important factors for any person who's working is money, benefits, security, and lifestyle. I think all of these, to varying different degrees, are important to all of us. And generationally, it appears that there are people who think money is. Oh, go ahead and we'll go ahead. I think we have a caller. Hello, you're on the air.
Hello.
Hey, can you, we appreciate you calling, but a couple of things. One, I have to tell you the phone lines are open because I'm going to give this talk first, and we put the number down. And could you do me a huge favor and just wait until I give that notification to call in and then call back if you wouldn't mind?
I sure will, thank you.
Thank you, just a few minutes, thank you. But I think to varying degrees, there's, it was Vicki, yeah. I
I'm
would
really
have said
curious
it to somebody
what she
else.
had to say.
Yeah, no, she'll call back.
Okay.
Vicki called back, I'm very sorry. But so I think to varying degrees, we all have a different view of how much money versus time, how much security versus lifestyle, work time, and so forth. So I think it's important. but there are these opposing forces that just take place all the time. There's the employer, get the most out of any one employee for the least amount of pay, and the employer and the employee work the least for the most pay. And I had mentioned this earlier. Now, those are just extreme examples. I think a lot of employers understand what it's like to be a rank and file worker, and they want to provide for a good work-life balance. And I think a lot of employees are much more willing to do more, go that extra mile, if they feel appreciated. And I don't think that's anything to do with generations. I just think that's human nature. But nevertheless, somewhere in there is a balance. There are some intangibles with employers. You want an employer that values the lives of their employees. Employers hate attrition. They constantly work to grow and add services. In other words, they want to create more work for you to do so that they can then hire somebody else, because they can't hire somebody else in hopes of growing more work. They want to grow the work before they hire people. That's just a business decision. And so everybody has to be on that same page. You want employers that offer opportunities to do stuff outside of the box kind of thinking, like this, that are approachable and will listen to better ways and more efficient ways of doing things. That's a good employer. A great employee is highly motivated, just wants to work 24/7. They look out for the department of the company. But they have boundaries, and that's important too. But communication is the key. You can have boundaries, but you need to be able to communicate those in a clear, reasonable way. They take the good with the bad, so they have balance. There's no perfect job. Every job has its good points and its bad points. And they're not afraid to speak up and offer suggestions in a respectful way. That's what you want from your employees. And if you have a complaint, for God's sakes, please have some suggested solutions. The worst employee is the one who just points out everything that's wrong, but never gives a suggestion as to how to make it better. We are a cost center as perfusionists. This conference is really driven towards perfusionists, the only CEUs, but I know a lot of other people may be watching that aren't perfusionists are also looking at this. Okay, hold on. Have they seen these slides? Oh, I'm sorry. Everybody, I've been moving my slides on my computer, but I'm forgetting to hit the button here. So we've all seen all of this stuff, and I apologize for that, but I'm learning, okay? So we're on this slide. And so we are a cost center, not a profit center. So first of all, I call BS on that. And I'll tell you why I do that. You can't do heart surgery without us, okay? You can't run the cath lab without us, because that could be an emergency case, even though they have freestanding cath labs. But those, that's a different issue, and I'm not sure that's such a good idea. And then what about ECMO? Who's going to take care of that? Second, it's actually true. So it's a contradiction. A cabbage gets paid about $31,000. That's the average, and this is the study. I'll go over this chart with you here in just a second. But out of that, they have to pay lights, equipment, staff, disposables, the ICU, the step-down, and us. There is no charge that the hospital is able to recover for our services. We are part of the bundled care of the patient. So here's the information that comes from Medicare payments, and you can see here that the average cost for a cabbage procedure is about $31,329. Back surgery, hip fracture, and colectomy. So you can see they get paid a pretty good amount per procedure, but they still have to pay all of those things. That equates to, that $25,000 is higher by 3% if it is a low volume or teaching facility, and it's costing about $171 million annually, because the lower volume accounts, non-teaching facility, forgive me, the lower volume accounts are far less efficient, hospitals are far less efficient, and the patients are actually in the hospital longer. They're intubated longer. They have a longer length of stay, ICU stay, and total length of stay. But I think this last paragraph is really the final sentence, is the researcher concluded that the steps to improve CABG efficiency are twofold. Advise patients to avoid low-volume healthcare providers and encourage investment in improving the reliability of hospital care. For us in private industry, how many hospitals are we affiliated with that do less than 50 cases a year? None?
Nah, maybe
At least
one.
a couple.
Maybe
One for sure.
Maybe
Pretty darn
one.
close.
Pretty darn close, okay. But that's
would
pretty
say
low.
two.
You would say two?
Two.
Yeah. But I think that's common.
Yeah.
I don't think
Right.
that's so uncommon. You know, there's what, 180,000 cabbages done per year in the United States, and of the big facilities in the medical center, that's only about 20% maybe that get done there. All the rest are done in community hospitals around the country. But stay away from low volume accounts. Profit. 200 hearts a year is going to yield at that $25,000 or $31,000, about $6.2 million. To operate the hospital, I'm sorry, it's $25,000. Based on that $25,000, is going to cost about $5 million. Does not also include, however, the loss leader of the cath lab, because that generates an enormous amount of money. But you're still looking at a 200 heart account makes little over about $1.2 million if they're doing 200 cases. That's not a bad profit, okay? But they want to make more. And what cuts into profits is long vent, ICU hospital, if they have a stroke, renal failure, reoperation, staffing, attrition, vacation coverage, FTE versus contract. All of these things cut deeply into that profit center. So if they're making $2 million or $1.2 million and they have one stroke, then they're down to $1.1 million, because you're losing about, I'd say, $75,000, $100,000 to the hospital that's going to eat because of that stroke. Oh, I had to push the buttons. Okay. If the hospital has FTEs, 3 FTEs are going to cost the hospital about $400,000. Now, they're doing 200 cases a year. They might only have 2, which means you're 50% call, which means you're probably working every day, and they're probably doing cases on the weekends as well. And so you're not going to have any work-life balance. But if you have 3 FTEs, you may, unless you get an ECMO. If you're doing ECMO, then you're not going to have any. You're going to have to bring people in to help watch that. If you're just a contract group that's doing just that hospital, in order to make the same living, it's going to cost the hospital roughly the same. But where contract companies come into play and where this ability to staff is when you have a contract company covering multiple hospitals that are 200, 150 case hospitals, because usually it's the same set of surgeons and they're moving around, and you can do this with far fewer staff than if you had to put 2 or 3 FTEs in every single one of those hospitals. In the above model, this one here, the final one, in servicing multiple hospitals in the area as a contract group, you're going to save the hospital roughly $200,000 per year. So you can see in that scenario, there is profit capability for the company and there's savings capability for the hospital. And where in that range it falls is going to depend on negotiating, competition, and other various things like that. You want to bring value. You want to understand the market, and yes, it is highly complex, but it's very easily understandable, and I highly recommend to my younger colleagues they spend the time to do that. Provide a balance, define your own job, and communicate it. I think that's very important to do. Communication is the key to all of us understanding each other. Go to meetings and bring back new technology that could be a revenue source for the hospital, like TCD, like the AngioVac, like CRRT. Consider what you are being paid for and your workload. But remember, create a balance, but always be perceived as a team player, but never a doormat. And understand your employer as well and what motivates them. So it's a two-way street, whether it's generational and old people like me dealing with young people like you, at the end of the, or mid-range people like you and Rodell and Stephanie. The only way we're all going to be able to work together successfully and be able to do what we do and have personal satisfaction, regardless of how we define that satisfaction, is to talk to each other. And I think that historically, perfusionists are the worst. You can have two different groups at two different hospitals directly across the street from each other, and the perfusionists never talk to each other. It's craziness. I think we need to be more collaborative, come together more, understand each other more, respect each other's views more, not we think you are this, therefore it's bad, and you think we are that, and therefore that's bad, but a better understanding of what makes each of us tick. I think that was my last slide, Raj. Oh, I forgot to do. That was my last slide. I forgot to hit the button again. I did terrible with this. Okay, are we back on?
Millennial to teach you how to use Keynote.
Yeah, I'm working on it, okay? Remember, do I have to go back to my chart? Okay, I had to learn this stuff, all right?
No, you're very good, actually, Joe.
Thank you. Okay, so thoughts about all of what I said about work? Rodell?
No,
and anybody that wants to call in, Raj, you want to put that, I'm so sorry, put that, that number up. So if anyone out there in the web, Vicky, and I appreciate your patience, if you want to call in, now is the time to do it. So call in, and I got to check and see if anybody sent any chats.
Yeah.
Go ahead, Ro, I'm sorry.
Well, no, it's actually, it's a good point. It's honestly a two-way street. You know, I like to bring in new things, and I like to get heard. And it's sometimes we do need that employer to, talk to us. Maybe we do have some ideas or just don't know how to convey them. But you do a really good job of it. I think every employer has to find each employee's passion. And I think that begins that two-way street. So I think you've actually kind of tapped into, Steph and myself when it comes to that.
Well, thank you. I think you were paying me a compliment.
I was.
Well, thank you. Thank you so much. You're making me feel bad. Is Stephanie there?
No, she's actually downstairs. She's making plans. We are on vacation.
Oh, and that's right. Rodell is in Baltimore seeing his new grandbaby, and which is fantastic, and was kind enough to take time out and Skype with us.
You gonna wake the baby up and show that's the baby, or no?
No, actually, we are at our Airbnb because we don't stay at hotels anymore. Although Joe, being the old guard, thought it was very strange that we were staying at someone else's home, but what the kids do, I'm embracing it.
Yeah, it is. It's bizarre to me. It's bizarre to me. And that's going to be our last session, is just call in and chat and stuff about that very thing, just on a question and answer discussion. And it's going to get pretty intense because I've got some really I've got some deep thoughts about this, and I'm going to challenge you guys to a lot of different things. I think we have a caller. Go ahead, you're on the air.
Hello.
Hey, you're on the air.
Hi, this is Vicki calling back again.
Yes, thank you so much for your patience.
And so I just have a couple of comments to make about your comments earlier. Hospitals and supervisors learn who they can lean on to cover staffing needs, and sometimes their staffing problem isn't the immediate problem. It's that they have caused their own problem through their administration, and they learn who they can call and prep and depend on coming in, and I think they dip into people's goodwill tank and play on their emotions to come in. So, with your question earlier of feeling satisfied to go in and do the case or to stay home with your family, I think it's a hard choice to make when you get satisfaction out of both, but you can't be played all the time either. So I think it's good to give more sometimes, and it's also good to say no sometimes and protect your own goodwill from going dry. I think there's always balance, but there has to be balance and respect on both sides. And you have to make that decision what's good for you and your family to live with too. And it's not just the job that's important.
Yeah, I think those are really good points. And Roger, we'll just call that number back after we hang out with Vicki, because I think this is a good discussion to have. Now, you were a nurse for 20 years, and then an anesthetist for another 10, 15 years. So you have a pretty long work experience. But how much of your, and I remember you having to leave in late at night to go sit with a patient that you were going to do an epidural on. Now, you were on call, but every time you did, I sensed at least that you had a level of pride associated with you were going to be going and doing that. So are you saying that given the same set of circumstances that I presented to Mike and the entire panel really on that procedure where you're called because let's say you do some block that nobody else can do, or whoever was on call maybe didn't have the same level of confidence from the physician, and you had you missed some event, let's say your mom's birthday party, would you be disgruntled about it, disappointed about it, or would you be prideful of it? I think that's really the crux of where I was trying to go with that.
Well, I think there's always pride in the work that I did. I think it was. I think where you're getting is, are you resentful because you're having to go in and miss your family time? When you're on call and you've taken on that responsibility and you know what that responsibility is, it's hard to be resentful when that's what you've signed on to.
Yeah, but you're not. But the scenario.
What I'm talking about is when administrations or hospitals.
Mm-hmm. But I'm asking you.
Your goodwill as a tool to get you in to cover their staffing needs when they mismanage their staffing problem.
Well, I think that's a great point, and I think we need to elaborate on that. But you're missing. You're not answering my question first, which is the scenario is you're not on call. You're not on call, but you have a unique capability that is more valued than the person who is on call, and you're being personally asked to come help take care of this patient, and it results in you missing your mom's birthday party. Are you going to be resentful of that, or is that going to give you a sense of pride without any sense of resentment at all? Not anything to do with administration's mismanagement or department heads' mismanagement. It's specific to that unique set of circumstances.
Well, I think that goes back to the old saying of that graveyards are full of indispensable people. You can't think that you're that indispensable that it's only going to be you that can take care of the problem. I can understand occasional circumstances. There's always going to be emergencies, and you just had 4 or 5 ECMOs going in, and it really creates a staffing emergency. And I think people can see that. They can see when there's unique circumstances that you need to be there, and there's times when you're just being called in, but it's easy to get you to come in.
Well, now that brings up a separate point. You really, I mean, and I appreciate it. I'm not really getting from you what I'm asking, but you're bringing up another issue, and that is staffing levels of the employers. And let's talk about that. So right now, if you get called in but you're not on call, what's the likelihood you will get called in? Is it very, very, very low, almost so remote it's not going to happen, or does it ever happen?
If I'm not on call, no, it's not going to happen.
It's not going to happen.
Not where I'm at, but we have a different relationship with, our hospital is different also than y'all's relationship with your surgeons, and just the size and whatnot too.
Well, the dynamic is different. You're
right,
an institutionalized department and so forth.
None of my surgeons know my name, I'm sure, so.
They don't know your name? Really?
Well, it's just different. You guys know them on a personal level, and we don't.
Yes.
So.
Okay. I didn't realize that. I didn't know that. You mean Dr. Lowry doesn't say, he doesn't bring you a cup of coffee every morning?
No.
That I am surprised about, okay?
You're going to have to make a phone call.
I am absolutely surprised. I'm going to call him up.
Please don't do that.
No, I am calling him. So, you've seen, I think, both sides of this. And Vicki, you can elaborate on this as well, because you worked for the state, but you've also done some private work, and so I think you might have some good perspective. Have you worked for employers who simply did not make sure you had the resources you need to even come to where there was routine, that your life was interrupted because of a lack of resources, and then you were not compensated for that sacrifice you had to make, but it was simply expected by your employer?
No, I was always compensated.
Okay. So, but you were either a state employee or of something of that sort. So let me ask Mike. Mike,
That's happened frequently through all the different companies that I worked with. We routinely would say that we're one person down, and that seemed to be the way it was run. If they're one person down, that means we got everything covered, plus additional if they volunteer the extra work, and so we can cut off one FTE and make more profit from what we've done before.
In other words, you were overstaffed.
We were, we were understaffed.
No, I know, overstaffed.
And we were never overstaffed.
Right, you were overstaffed.
Never,
grossly
never
overstaffed.
And to the point there, there's been a lot of times that me being around as many years as I have, I've done a lot of proctoring of the new employees that have come on with the different companies that I've been with. So more often than not, I was asked to go in with this person to do the more difficult case. I've been asked on certain times when I wasn't on call, they're doing it, but they maybe have not seen that before. Could you go in? Especially with ECMO. If some of our new people did not really know how to put a person on ECMO and didn't feel comfortable with it. So there were many times I was asked to go in and provide that backup and knowledge to those people. And that happened quite frequently. So I would see scenarios that would play out a lot, and it got to the point where I would just say, Monday through Friday from 7 a.m. to 7 p.m. Monday through Friday, I'm on call all the time, whether or not I'm on call or not. And that was just something that I did because I knew the chances of that happening, especially with some of the new employees, was gonna happen. And I just accepted that as part of the extra responsibility that I would have to do, and I
that came with your seniority and experience.
It came with seniority and experience, yeah.
Even though it should not have been something that your employer expected you to do.
That's correct.
I agree with you 100% on that, and I think that's what they are way smarter than us about.
Yeah.
Ro, you recently joined our group, but you came from a hospital setting for many years.
Yes.
What was your experience like, based on what Vicki was describing, what everybody here Mike was just describing, in terms of your life being interrupted, even if you were not on call and the responsible party at that time?
Well, here's the thing, I was never the guy that was getting called because, I was in the middle. But I felt like I needed the help where I could. I mean, if I knew somebody was going in, I just knew that, like, hey, I can lend a helping hand. And, I know I'm not on call, but I never want to be in a situation where I couldn't handle it and an extra pair of hands could be used. So, yeah, I mean, I did it a couple times.
Okay.
I mean, I still do it now. I mean, if I know that, say, like Patrick was in a jam, like I knew, like one time he was doing a very tough case, and I just knew he was going to be there all night.
That was like 20 times.
I'll give you a break.
Yeah, but that's just, is
I mean,
that kind of taking this whole thing full circle? Is that our profession, or is that generational?
I don't know if that's our profession or generational. I think it's just courtesy. I think it's just, hey, it's that kind of like, hey, I don't want to get stuck with my pants down if I could help it. Mm-hmm. It's I don't expect that from anyone else, but it's really, really nice.
Mm-hmm. Vic, what do you think? You want to finish up your call with any thoughts?
Unique spot where, like, hey, I can call Stephanie and say, Stephanie, I know you're not on call, but hey, I need help, and she'll be right there.
Mm-hmm. That's because Stephanie's the best. Vicki, go ahead.
I would like to think that it's not generational. I think we sometimes think with the younger people that they don't have that type. But I think it's the young people that tend to have the young kids and more responsibility when you get people that are in their their 40s, 50s. They have less of that responsibility. So I don't think it's that they don't care. I think it's just they have so much responsibility spread around that they have to say no more.
Mm-hmm. Okay, well, Vicki, thank you so much for that. Roger, do you want to go ahead and call that other person back?
Yeah, I believe also, too, Joe, I mean, here's something, too. I mean, I just had some really great mentors, and, and they passed on some stuff that I want to pass on as well, from my experience as well. I mean, I think I get some satisfaction from that as well. I think that's another reason I liked being a clinical instructor. It's like, hey, if I can pass on a little piece of knowledge and that'll help out a patient, that's what gets me up.
Okay. Well, I appreciate that. Okay, so we're going to take another quick break. We're going to have come back, and I think we're going to show all of our sponsors' spots. So it's probably going to take about 6 to 8 minutes. So it's a good opportunity to get another drink, pour yourself some more wine, whiskey, or pop another beer, and we will be back in about 6 to 8 minutes, and we'll wrap this up. Hopefully we'll get, I need to give you 10 more seconds, and we'll wrap this up with some hopefully more call-ins. We appreciate it. Vicki, if we don't get any more calls, call back. And we'll check the chat and all that kind of stuff, but thank you very much. So we're going to give you, here we go with all of our sponsors, and we want to thank them all very much.
Imagine trying to drive a car looking only through the rear-view mirror. Critical decisions would be based on old and possibly inaccurate information. The same can be true of performing cardiopulmonary bypass without continuous inline blood gas monitoring. Terumo's CDI Blood Parameter Monitoring System 500 continuously delivers 11 critical blood parameters throughout the procedure. With other systems, periodic blood gas measurements provide static information. That is helpful, but limited. Continuous monitoring tells you what you need to know every step of the way, and that reduces risk. Studies show a direct correlation between blood gas management and reduced complication rates. The CDI System 500 has been earning the trust of cardiac hospitals and cardiovascular surgical teams for almost 20 years. It provides continuous monitoring of 11 of the most critical blood gas parameters, utilizing industry-leading technology. During cardiopulmonary bypass surgery, the shunt sensor can be placed in any arterial or venous shunt, or purge line with continuous flow. The shunt sensor uses optical fluorescence technology to measure PO2, PCO2, pH, and potassium in the blood. 4 microsensors and a thermistor well are in direct contact with the blood to accurately and rapidly measure the values. Light-emitting diodes direct light pulses toward the microsensors, which contain fluorescent dyes. The intensity of the fluorescent light from the microsensors will vary depending on the levels of PO2, PCO2, pH, and potassium in the blood. The photodetector measures and converts the light to numerical data, which is then displayed on the monitor. Blood values are always current with virtually no gaps. There is no need to make difficult judgments about when to draw a sample. Gas source or oxygenator failure can be rapidly detected. Continuous monitoring is especially beneficial during procedures on young or old patients, or with smaller perfusion circuits. Peer-reviewed clinical evidence supports the value of continuous blood gas monitoring. Contact your Terumo sales representative for a demonstration, or visit terumo-cvs.com.
Stephanie with HET Perfusion. Oh, okay. We have an open heart 1 month from today, 9 a.m. start. Oh, really? A single vessel off pump? No problem. Thank you. Hey, Mom, can you bring me a sandwich?
Y'all want to squash me? Yeah.
Oh, thanks, Mom. You're the best.
You having a rough day, baby?
Oh, working for HET. So hard, huh?
Stephanie! Go on the pump.
Okay.
Is that better?
I'm like smiling now.
Okay, so welcome back, everybody. Good to see everybody back with us. We have a caller, and of course, if you want to call, Roger will keep the number up so that you can do that. David, do you have some comments? So where you work, who are you, what do you do?
I'm in Houston, and I'm on a Perfusion.
Say again, you kind of, say that, hold on, say that again. You got real muffled.
Okay, I apologize. I work in Houston as an auto transfusionist, and obviously I work in the perfusion group. So I think that I can see and form an opinion, fairly educated, on what I see coming in. And I guess my question to the panel is that with these young and upcoming professionals, do you guys, I guess for a lack of a better term, find it necessary to take them under your wing and kind of show them the ropes as to what real life in a perfusion company is like? Mm-hmm. And by that I mean, you know, what we're all in this for. And obviously, I'm like a Gen Xer. Okay, so I'm cut out of a different cloth than some of these guys are. I'm prior military. So, looking at what's coming up, you're seeing that they lose sight of the prize. You know, the prize at the end of the rainbow, which is patient outcome being as good as it can be. And what you find is they lack the, I guess you could say, I don't want to say work ethic. It's just their generation as they are brought up to not necessarily make the same sacrifices as we do or we have. And I guess that's what my point is, that all of us in the past, in the old guard, found it necessary to do whatever was necessary to get a favorable patient outcome. Now, what we're seeing is a lot of these guys are not necessarily used to making these kind of sacrifices, and I just want to know if, you know, the panel or Rodell or yourself find it, you take on the responsibility of kind of educating these guys.
Okay, so I think I got it. And let me ask you, David, real quickly. Just how old are you?
48.
So 48. So you fall into the Generation X, isn't that right? So you
Yeah.
fall into Generation X, but kind of older Generation X. So kind of, sort of, just in it, as opposed to, because I think I don't have to go back and look at that slide, but I think 54 started was the baby boomers, right? 54 was
That
the
should be
youngest
about
baby
right, I would
boomer.
say.
I think it was
46 to 64.
yeah, 46. What year were you born?
69.
59. So
69.
69. Okay, yeah. So
Game
5
10
years.
years.
5 years out. Okay. Well, listen. All right. So we may have some other callers. So we're gonna address this and put the other caller on hold. So we're gonna disconnect from you, but address this. Okay. So it's a good question. I mean, I think David brings up some very interesting points that I think we have been addressing throughout this conference, and that is that he's a little older. He's in Rodell's, maybe he's a little older than Rodell. You're not that old, are you, Rodell? But he's in his, he said he was 48. How old are you?
I'll be 40 this month.
40 this month, so he's actually 8 years
He's
older
closer
than
to
you.
me.
He's
I'm
closer
50.
to you, yeah. So I think that there is this perception, but I think we've been hammering at this all night long, and I don't think that the perception, at least this is my take on it, is a reality. I think that, you know, the younger generation are just as interested in patient outcomes, in making sure that they do a good job for what their responsibility is, but I'm distilling this down and coming up in my mind with this is a difference in holding employers more to account for providing not only a job, but a job that respects a work-life balance. Whereas I think that the millennials, the younger generation, is wanting to provide a good work product to their employers without being the doormat or being the always available. In other words, they want to work because they want to have money to live and enjoy their life, the experience of life. Whereas I think we, the older generation, and to some extent, the Generation Xers, Rodell and Patrick, we lived to work. They're working to live, we were living to work. And I don't really think that defines, I don't think that's bad. Frankly, I think I don't know if they have it right, but I can really say honestly, I don't think they have it wrong.
You know, not too far from being a baby boomer, I was almost a traditionalist by the first slide, being that I'm pretty close to that age anyway. And our generation was, you were what you did. As
you were defined by work.
You were defined by your work. Mm-hmm. And we probably took it, what I see is the problem here, we took it to one extreme, very much to an extreme. Whereas the millennials, I think, don't want to go to that point. So the gap is there because we thought our work defined us, whereas they want to define themselves with the work that they do.
Yeah.
Am I making sense?
Yeah, I think
so.
It's tough.
It's a perception.
It's somewhat convoluted.
It's a perception. It's
you know?
a perception. Yeah.
It is a perception. Let's go around the table. What say you? How do you address David, who thinks, and I don't think he was being insultive. Okay, you can go ahead and put it on. Hello, you're on the air.
Hey.
Hey, who's this?
Hey, this is Min Tran.
Hey, Min Tran. Hey, Min, how are you?
Good.
Good. What you got for us?
Well, I just want to say that I think everyone there tonight made some pretty good points, and with Vicky's comments calling in and the things she had to say, and I feel like I'm probably only a quarter of my time in my career with where you and Mike are, but so I guess I'm kind of in the middle of the pack compared to Christina and Brett and Patrick up there. I'm probably right up there where Rodell is because we're about the same age. But I think nowadays where things are going with work ethics and the new perfusionists that are coming in and perfusionists my age and older, I think it's ongoing and evolving. With depending on where you work and the places you've been and where you train, and I think it's hard to say that the younger ones are getting lazy or their work ethics aren't just quite as the same as where we are, but I think it has a lot to do with your background and just the training you've come from and the places where you worked, and those places really impact and make you the perfusionist you are, and those are the tools that you take to your job every day.
Yeah, I think that's also a very good point. So do you feel that it is more nurturing, I guess, how you grew up, with your parents, the example they set, the values they instilled in you, your early career, how you were trained, your first jobs, and sort of what the expectations were of you, versus just simply what age group you are and those experiences that were essentially social in nature? Is that what you're saying?
Absolutely. I feel that those factors definitely impacted my work ethics and who I am today. I didn't become a perfusionist straight out of school. I was a respiratory therapist for about 5 years. Even before that, I've always worked, when I was in college, and my parents had a grocery store and I helped them at work. So I knew work ethics and what it felt like working as a teenager and growing up in college, and then being a respiratory therapist, dealing with patient care and dealing with multiple personalities and different departments. And absolutely, those things have helped me put together a strong work ethics and background to be, where I am today. I've also had the opportunity, the great opportunity to work at different facilities and programs that, help me embrace what it's like to work at a hospital setting versus a contract setting. When I worked in Virginia, I worked for a hospital-based, contract group, but it was a small hospital-based system. So you didn't deal with so many personalities, but I got to feel what it felt like to work that kind of hours and with a short staff. And I also worked at Methodist where Brett and Christina works, and I worked there for 3 or 4 years, and I got to see what it was like to work for a hospital setting in a bigger program institute, the kind of hours that they put in, the responsibilities, the multiple surgeons they work for. And so definitely both scenarios have different hours and longevity of work schedules compared to probably what every other small or large contract company may offer. And I think it's just those experiences that you gather from when you're a new perfusionist to 5 to 10 years experience. I think hopefully most perfusionists will pick the strong work ethics along the way and learn to work as a team, understand that the concept of, you're not on call, but then you're always on call, like Mike said. You may have new people come in to the program or to the staff, and you may have to help out. And that's just part of being a team player.
That's exactly right, Ben. And remember, first call does it all, Okay, that's another saying that you guys need to remember, all right?
That's
So
right.
we've got, stay on the line with us, Min. So we've got 2 questions, chat questions. One from CS. I need to ask CS and Jennifer, if you're still online here, can you just send me a quick text chat and tell me what your professions are and your age? Your professions and age. So CS asks, does the panel have any experience with the perception that baby boomers and Generation Xers have a more patient-centered company approach than millennials who are perceived as patient-centered and individual? And to finish the last thought, he adds, millennials are perceived as patient-centered but individualized, whereas millennials are more aware of their skill and value than what Generation Xers or baby boomers have historically been. That's question 1. And then Jennifer has a question. Perfusion, she's a perfusionist in Birmingham, and I wonder how much of the observations made of millennial behavior has been impacted by their exposure to older generations expressing their regrets, comments, and opinions. And she adds, as in boomers expressing regret for working long hours and sacrificing family time despite having pride in their work. Those are 2 really, really good questions. So, you know, let's start with Skype. Let's start with Rodell. Rodell, what is your thoughts on boomers and Generation Xers being more patient-centered / company approach than millennials being more patient-centered individual approach, and how much of your experience with younger millennials coming up in your training centers have been influenced, if you will, by your perception, your philosophy of how work should be done. So the question is to you first, and then I want to go around the table and have everybody address that very same question. So I'm not going to ask it again. Go ahead, Ro.
No, that's actually, those are really great questions. You know, it's really funny. You know, are they? That's really good. I guess it's very strange. The baby boomer generation just wants to, like, I guess, wants that younger generation, I feel, that younger generation, including myself, not just the millennials, to, I guess, be trained through their type of attrition. Because I think they feel that their type of training was the best. And I'm not saying that it wasn't or it was. I think they just want to have them get dragged through the mud so they can experience everything and just be that much better. And I guess maybe on the other side of the coin, that millennial wants that older generation to see their side of that coin, what they've been through, and because they feel they've had the best training. Do I think they've been influenced by, say, some of the regret of the baby boomers? I think so. I really do. That's just my opinion. I mean, I've been influenced. I mean, I've heard it in my profession. You know, behind the pump room door, if you will, like they wanted to see their kids, but they just had this tie to their profession and that need to provide that type of service because no one else could do it.
Mm-hmm. Good points.
You want to go ahead?
No, it's on you.
No.
No, you're next.
I'm thinking still.
You're
okay,
No.
Hey, maybe it's on.
The patient is dying. The clock is running.
This
okay.
is not the same thing.
Tick tock, tick tock, tick tock. No flow. Brain's dying. Come on. Go on, pump.
I guess in regards to the question about are we influenced by the baby boomers and their regret for not being present more, I think, yeah, that definitely has, that makes an impact. And the second question, I really didn't, it was more of...
Yeah, well, are you more centered towards, the way I'm reading the question, and it could be that I'm just not reading it well, patient-centered, but as an individual, in other words, patient-centered, individualized, your life, your responsibility to them, or the team concept, patient-centered. In other words, you still care about these patients. You have the same value of the patient, but you have an individual mentality of I'm important too, versus more about the team is important. I as an individual am just part of that team.
I think it's a combination of both. For me personally, I mean, like we were talking about, I do value work-life balance, but that doesn't mean that I don't value teamwork and being a team player for my team and, you know, being there for a teammate if I need to, or even if they don't ask, that sort of thing. So I think it's both, but I think maybe we value more than the baby boomers and Gen X, the work-life balance. But
Patrick?
So I think I would be I guess I'm a Generation X, but a pretty old one, so I'm probably in between them. And I have spent a lot of my career working as hard as I could, so I feel like I'm learning things from, you know, millennials, important lessons. And
me too.
Yeah, I know you kind of leaned that way earlier, and you know, I think that they kind of have it. But as far as what was the second question? Can you repeat what was the?
Yeah, in other words, the first question has to do with, and I think it's just complimentary that all generations are patient-centered. We care about the patient first. I think everybody gets that. Nobody cares less about whether the patient lives or dies, or has a great outcome. But I think K-Dog says you're super cute, by the way, on the K-Dog. I don't know who K-Dog is, but they said you're super cute. You know, Patrick. With all of that said, but they focus more on the team versus themselves as an individual. So are you thinking that I as a person am ultimately what's important, or the team is more important than I as an individual, as being part of the team?
Yeah. Okay, what's great about being a perfusionist is that you have a skill that they can't do that procedure without you. And so you put a lot of, you know, it's a really wonderful thing to have that kind of a skill that everybody, not everybody, but in your profession, that they need you to do it. It can't be outsourced to some other country or anything like that. You have to be there, and you've got to, and so that's a big responsibility, and you can take pride in that. The team part of it, if you work with a good team, there's a lot of pride in that, and it feels great to work with a great team. I'm working with a great team right now where everybody supports each other, but I've been on the other side of things as well where you're not. And so, you know, can you teach that? I guess that's just sort of life experience. I hope I've answered the question.
No, I think you have. I think both of you have done all three of you, including, I think we lost Rodell, done an extremely effective job at answering that question. Mike?
To the first part of the question, yeah, I think the older groups do tend to want the team approach to be the stronger indicator of their satisfaction in the industry, and I think it's really, really important. Like I said, Patrick too, he's part of my team, and I work now with the best team I've ever worked with in my entire life. Been very fortunate to do that. I can honestly say that. And when you have a great team, you realize how important that team really is. To the millennials and the individualistic, that's fine too. That's fine too. I think, you know, if the individual wants to become a better individual, and I think that is the approach that you guys are doing, that you want to be able to stand out, and I think that's great. I appreciate that. To the second part of it, and I may have had more to say about this than the other people, because I was the one that answered that, yeah, I could give up my daughter's recital, which I never did. But I did feel the need to be important for the job that I did. It was self-actualizing, and it was very important to do a good job and to have people know that, you know, Mike Brown did that case, and we can always depend on Mike for those types of situations. Do I feel that we gave up a lot? More from a personal responsibility, given too much of myself, possibly, and robbing some of the attentions from my family. I was very fortunate to have been married to a CV OR nurse my entire life who understood what my life was about. So that helped a heck of a lot. Would I try to have more of a balance if I were to do it all over again? Yeah, but I didn't think that was allowed to me being an old timer, because it was always instilled, you know, you work till the work is done, and then if there's any time left over, that's when you enjoy. So
good points. Professor Brett?
As far as the I and team, I mean, I personally think you better yourself to better the team. I go into work and I try and do the best I can, and I think that it will help the team in the long run. And of course, I want to have good teammates. If not, then it's going to be miserable. You know?
Well, yeah, I mean, you know, if you can't, if your team, and I think I'm hearing all of you very clearly that in a pinch, none of you, nobody, whether you're just graduated from school 2 years, 36 years, 20 years, Min 15 years, Rodell 15, 18 years, me, they call you and say, I really need your help. They are not joking. And you know what the consequences are of not, that they really, you know what they're going through. So you're going to go. And I think that we've sort of, that's been a large part of this conversation, but I don't necessarily think that's really what the message is. But you're going to do it for 2 reasons. One of those reasons is you know what they're going through. They're in trouble, and you got to get there. You got to help them. But you also know it could happen to you, and you want to be a part of a team that will come and help you. So if you don't, and you say, "Sorry, good luck," then what should you then expect? You probably won't get the same thing, and I don't think any of us would ever do something like that, but we would be upset by that, but we wouldn't punish them or anybody else for it. We'd just be mad. Because I think that by and large, the human experience, I have a lot of faith in humanity, even though there's been many things that have happened to me in my life that have at times brought humanity into question and people's values or whatever. But I think at the end of the day, the majority of people, whether they're medical professionals like us, perfusionists, physicians, nurses, CRNAs, ER paramedics, first responders, teachers, it doesn't really make any difference what it is. I think that we as humans inherently want to help others, and we gain pride and gratification from that. So, you know, and I think that the message here is really about both personal responsibility, expectations, and needs, and also responsibility by institutions, program directors, department managers, company owners, whatever, to recognize that times have changed. We're no longer in the Industrial Revolution. It is the era, it is the information age on steroids compared to what I'm used to. And I think that to some degree, your expectations are, well, to a large degree, rephrase this, reasonable, but at the same time, a small portion of it maybe not really completely that I agree with. And at the same time, I think that for the Gen Xers and for the baby boomers like Mike and I, and for Min as a Gen Xer, Ro as a Gen Xer, that what we've done in large part, I think, was right for us, but at the same time, a portion of that I disagree with, have my regrets, you have your regrets, everybody has our regrets for various reasons, but in our profession has a higher calling associated with it. Patrick, I think, brought it up. We're one of very few people. You think about the city of Houston, as big as this city is, and we probably have 20% of everyone that knows how to do our job sitting at this table and on that television monitor right there. That's in comparison to the number of nurses, the number of even physicians, the number of paramedics. It's baffling to me. However, I also think that Vicki earlier on brought up some incredibly powerful points, which was that employers have had a history of and a habit of taking advantage of that sense of responsibility that we have, that we've tried to impart to you have, Min has, and you have too, but they have shoved that into our psyche and made us feel like your sacrifice is absolutely required. And we did not have the savvy, the social interaction, the communication. We were living in a very confined space. So we viewed things from a much smaller microcosm than your global perspective because of how you grew up. And you're recognizing that, no, you're the employer. You have a responsibility to make sure we have enough staff. This is not acceptable that I have no personal life because of my job. We're not talking about the exceptional times. Those are different. Whereas we saw that as that is the job, but it's not. However, and with that said, what made you a great, and I will say this for the record, Mike, Patrick, Min, you're on the phone, absolutely incredibly great technicians and perfusionists in an operating room where if my loved one was dying, I would want any of them there, is the very thing that employers take advantage of and that they did in sacrificing all that time in their life, because their exposure and experience in doing this job is so much more than what you guys are really ever going to see. There's no way the days that we grew up in will ever be repeated.
Hey, I've got a neighbor who, I love this quote. He's always trying to get me to play golf with him, and I play a little bit of golf, but not that much. And whenever I say, no, I don't have time because I've got to do all these things for whatever reason, he always says, you know, when you're about to die, you are not going to sit there and say, I wish I hadn't played all that golf. And I love that quote.
Was my commentary too convoluted? I'm not sure. I kind of almost lost myself. Min, you have any final thoughts? Rodell, you have any final thoughts? Let's do Min first and then Rodell. And then I think we're going to be, we're over time. We're over time.
Yeah.
Okay, well, you know what? Huh?
Someone needed to round you up.
It was exciting. Oh, my God. Okay, well, we're going to have pizza, iced tea, and tequila. Min, if you want to come over.
Rum from Puerto Rico.
And rum from Puerto Rico. I want to thank everybody for participating here tonight. Min, we're going to have to go. We ran over. But I love you. You're still my favorite. And I love you, too. And listen, I want to thank everybody. We're looking forward to seeing you on the 27th. We're going to have an ECMO session, and it is going to really, really be intense and good. So we're hoping everybody comes back for that. And then over the next week or so, I'm going to be filing more Category 1 CEU applications with the ABCP for future events. Remember, if you don't mind, click the share button. Please, if you would, Facebook, subscribe, I'm sorry, the subscribe button. Hit the subscribe button. Facebook, share us. Twitter, share us. Instagram, share us. Get the conversation going. Bring more people into this conversation. And once again, I appreciate everybody. Thank you all. Good night.
All right.